The training workshop was aimed at educating principal health workers clinical knowledge of handling cases that require the use of oxygen. Patient management through administering oxygen was a vital knowledge that health workers were trained on during the event. The facilitator discussed hypoxemia disease, the causes, and the treatment with the trainees on how best to handle the disease.
Okay, this training is on hypoxemia and oxygen therapy for the treatment of hypoxemia. Hypoxemia can be defined as low oxygen tension in the blood. We know that oxygen is the gas of life. If you don't have oxygen, you cannot live. And this is traceable even from creation. When God created man, he breathed into man the breath of life. And so that thing that God breathed into man is that oxygen that makes man to be alive. And so the blood carries the oxygen, and that is what gives man's life. But surprisingly, in Taraba State, in our sectors, we not have privilege to be using medical oxygen. But for this time, thanks be to the Taraba State governor who saw the need to introduce this use of medical oxygen in our medical facilities. I want to say thank you to the Honorable Commissioner for Health also, and for my immediate boss, the Director of Medical Services, Dr. Marcus Nzunde.
The health workers were put into practical session during the training for adequate comprehension on handling oxygen cylinder on patients. The workers were also educated on the quality of oxygen equipment to observe while purchasing to avoid getting those of substandard value.